Hi everyone, I'm Dr. Arshad from the Brooke Surgery, and welcome to our live video today, which is all about NHS health checks. Feel free to ask questions as you go along, and we will endeavour to answer them within 24 hours, or even if I can try and answer them during the live video, then we'll do that too. We chose the topic of NHS health checks as our patients have been talking about this. They've become aware of this kind of service we offer here, and they wanted to know more. So we thought it would be quite useful for you to learn about the NHS health check. So what is the NHS health check? So NHS health check is a health check for adults aged between 40 to 74. It's designed to spot the early signs of stroke, kidney disease, heart disease, type 2 diabetes, and dementia. Now, as we get older, we have a higher risk of developing these conditions, and the NHS health check helps find ways to lower the risk of getting these conditions. And if you're over 65, we'll also be told about signs and symptoms of dementia to look out for too, because that's something that's very important and it needs to be addressed. So if the question was, how will the NHS health check help me? And what we would say is that during the NHS health check, we would look at your individual cardiovascular risk. Now, what does this mean? This is the risk of you developing a condition related to the heart or your circulation, things like heart attack or clots in your legs, and this will be explained to you. Now, the cardiovascular risk levels vary from person to person. Now, however, everyone is at risk of developing heart disease or a stroke or type 2 diabetes or kidney disease and some types of dementia. So it's useful to kind of figure out what applies to you and how we can manage your risk factors. So at your NHS health check, you'll be given advice on how to prevent them, how to detect possible potential health problems before they actually do any real damage. So it's, in some ways, it's like a preventative way of dealing with medicine, really. So what are the benefits of a health check? The tests work. So the tests are part of the form NHS health check have been proven by large long-term studies to be able to detect serious health problems, working out your risk of getting these problems and how to actually address them. Knowing your risk factors helps you. Okay, so if you find out that you have a risk factor for a health condition, it can be really helpful because you can do something about that risk factor to lower your chance of developing a condition. So for example, if at the health check you find that your blood pressure is too high, you can make lifestyle changes that can help reduce your blood pressure, which will then reduce your chance of having things like a stroke or a heart attack. Okay, so what kind of things am I talking about? So if you're a smoker, we'll give you advice and help on how to stop smoking, and how to eat a more healthier diet. Sometimes, we try our best to eat healthy diets. However, some unhealthy foods creep in, but that was really kind of being aware of that. And also one of the other points we would talk about is exercising. We would give you that advice here, but also we work alongside a service in Hyde called, within Tameside, called Be Well Tameside. I will post the details for that after the video. And you can self-refer without consultation with a doctor if you're in Tameside to get the advice for smoking, exercise, and health as well. So back to the health check. So the health check may prevent cancer and even lung problems as well. So though the health check is mainly aimed at lowering your cardiovascular risk, diseases that affect your heart and your blood vessels, such as heart attack and strokes. These risk factors often, however, can also be a risk factor for other conditions as well. So sometimes preventable cancers or lung problems that you might not be aware of. So the NHS health check could actually reduce your chance of getting certain cancers and lung problems, as well as the other problems that I mentioned. So what happens in the NHS health check? So first of all, you get a one-to-one health chat. Now, the NHS health check gives you the opportunity to sit down with a health professional and talk about your health. There's good evidence that spending time with a clinician, a health professional, to discuss things like lifestyle measures and exercises can actually have real long-term benefits. So what actually happens within the NHS health check? So the check itself lasts about 20 to 30 minutes. It's done by a health professional, usually a nurse or a healthcare assistant. They will ask you questions about your lifestyle, about your family history. They'll measure your height, check your weight, take your blood pressure, and do a range of blood tests. The blood test will be taken from your arm, and sometimes they can be done before the health check is done, so we can have 2 separate appointments, or they can be all done in one appointment. Now, the blood tests will reveal your chance of getting a heart disease, stroke, kidney, and things like diabetes. And if you're over 65, as I mentioned earlier, we will explain to you kind of the signs and symptoms of dementia to look out for, and giving you personalized advice on how you can reduce your risk of developing dementia, which can be quite a debilitating condition to be suffering with. And the kind of talks we will be talking about are how to improve your diet, improve the physical amount of work you do, which medication you might need to go on for your blood pressure, or even things like your cholesterol, and particularly your lifestyle measures, so how to lose weight and stopping smoking. So the question is, how can you arrange to have an NHS health check? So at the Brooke Surgery, you'll be invited for a free NHS health check every 5 years if you're between 40 and 74, and if you don't already have a pre-existing condition. If you're registered with a GP surgery that offers the NHS health check, you should automatically get an invitation. Don't worry if you haven't been invited yet, because you should get an invitation over the next 5 years, really. If you're not sure if you're eligible for the NHS health check and you would like one, or if you are eligible and you haven't had an appointment, you can ask us to actually book you in. So, as you may be aware, at the Brooke Surgery, we have a new online system which allows you to send in requests and get a reply the same day. So you can ask us a question on our online system, and we will get back to you, telling you about your risk or booking you in. The good news is that if you're not a patient at the Brooke Surgery, then you can actually register with us. We are accepting new patients here, and you can sign up on our website, brookesurgery.co.uk, and click the sign up button. So we'll have a few moments for questions, and we have had a few questions through on our online system earlier. So it says here, I have no illnesses. Why should I actually have this check? Okay, so that's a good question, really. We would like those to attend the NHS health check, even if you don't have an illness. This is because the NHS health check helps find illnesses within you. So you might have some risk factors that you're unaware of, such as a slightly high blood pressure or slightly high cholesterol. And without having your NHS health check, you may never find this out, and therefore you may not be able to improve your kind of condition and quality of life if you didn't have the actual appointment. Another question that we have here is, if I'm being assessed as low risk of all the conditions you mentioned, does this mean I won't develop them? Well, not exactly. So it's great that you're being assessed as a low risk. However, it's impossible to say whether you will go on to develop one of those conditions like a stroke or a heart attack or diabetes. However, it gives you an idea of what kind of changes you would need to make within your lifestyle, whether they're drastic changes or some moderate changes that will help improve and lower your risk. So I hope this talk's been helpful. If you think it'll be helpful for your friends and family, please do share it with them. And if you have any questions, please post them below in this video. I will be sharing that link for Be Well Tameside, so you can benefit from that referral for lifestyle changes. So look out for any invitation for NHS health check from us, and then we look forward to hearing from you. So thank you once again.